my name is Haral Adams, and I'm a registered nurse at Northeast Methodist Hospital, and I work in the emergency department. I would say one of my greatest achievements is that I get to be a registered nurse, especially during this time with the pandemic of COVID-19. Seeing people suffering, seeing people hurting during these turbulent times, it really reflects that this is probably this is why I became a nurse, to help others during their time of suffering, to be there for them, for their families who can't see the patient because of their illness, and knowing that you're probably the last person that they might see, especially working in the emergency department.
My name is Raja Greer, and I am a mental health worker at Laurel Ridge Treatment Center. I work on the Rio unit, which is our detox unit. Before I was a nurse, I was a professional tennis instructor at the Dominion Country Club. And what prompted me to pursue a career in nursing was the passing of one of my high school students. He had ulcerative colitis, which is a disease that doesn't have a cure, and he was looking for a cure for his disease while he was at Texas A&M. And when he passed, it jolted me to get back into school and pursue a career in nursing.
My name is Anna Welling. I'm a registered nurse in the ICU at St. David's Medical Center in downtown Austin. So before I joined school here, I was working as a medical assistant and as a manager of a family planning clinic. And I always knew that I wanted to work in medicine, but I wasn't sure which role I wanted to be in, whether medical school or PA. But when I saw nurses and nurse practitioners interacting with patients, the education they provided and the bonds that they created, I knew that nursing was the role for me. So UT Health School of Nursing helped prepare me to be the nurse that I am today by fostering relationships between medical professionals. We work closely with PA students and with medical students. And as a nurse in the ICU, I have great communication skills. If I need to call a physician, if the patient is requiring a higher level of care, I'm able to effectively communicate with the physician and advocate for my patient.
The School of Nursing program prepared me very well to be the registered nurse that I am today. The faculty is so passionate, so caring, and really wants to hone that in on each student as well, because nursing is a profession that is very difficult, very hard, but also very rewarding at the end of the day as well. The professors, the faculty, the staff, they are all there for the students. They very much so hone that in from day one when we start orientation to the end of our pinning ceremony towards graduation. They have been with us every step of the way.
The School of Nursing's mission and values gave me the opportunity to work with Dr. Cavazos and an organization called Street Medicine, where we provide healthcare to the homeless here in San Antonio. It was a very eye-opening experience for me, because before I just had this preconceived notion that the homeless are just looking for that next meal and they're just kind of waiting around for money. But I learned that these are normal people, regular people that have fallen on hard times, especially now with the COVID-19 pandemic. It's been hard for a lot of people, and so I was able to do different assessments, and we did some diabetic foot care, we did some abscess care, just a lot of different things, and it was right in my backyard. I mean, some of the homeless right by my house, and so it was a very eye-opening experience for me.
I think one of the greatest advantages of the UT Health School of Nursing is the many ways that you can get involved on campus and get to know other students, whether that's through the Student Government Association or as working as a supplemental instructor through the Student Success Center. There's so many ways to get involved and get to know your peers on campus.
So many opportunities for students to learn and grow and help out and give back to the community as well. That's a very important aspect of nursing. It doesn't just stop at the hospital, but you can also give back to your community as well.
The School of Nursing prepared me to be the nurse I am today through an experience I had being the president of the Black Student Nurses Association. We did an event called the White Coats for Black Lives. I had a speech and got to speak my story, and just seeing all the people, all the healthcare professionals standing out before me just was an amazing experience. What I enjoyed the most learning here at the School of Nursing would be the hands-on simulations. It was a chance for me to apply what I learned in the books and kind of lean on my other classmates and figure out what we're supposed to do for this particular patient, whether it was a pediatric patient or an OB patient. It was a chance to learn a lot.
I would say one of the greatest memories that I have from this program is being able to be the president for our ABSN cohort, being able to stand with my fellow peers and students, faculty and staff, and being able to give a graduation commencement speech and seeing my fellow peers go out and be registered nurses. I think that is such a rewarding feeling at the end of the day to see that I have peers working at the same hospital that I do.
My greatest achievement is graduating nursing school and being a new nurse in the midst of a global pandemic, and really relying on the skills and leadership qualities that I learned here at the nursing program to help me adjust to that climate and become the best nurse that I could be. I absolutely plan on going back to school to pursue an advanced degree. I'm not quite sure what that will look like yet, whether it's a certified nurse midwife or as a certified registered nurse anesthetist or even something like healthcare policy. But I love school, I love nursing, and I definitely plan on going back.